Intrusive thoughts, overthinking. Is it you? Is it some sort of disorder or disease process going on in your mind? Is it from your depression? Is it from your life experience? I'm going to dive deep into intrusive thoughts, overthinking, what they are, and what you can do about it. My name's Christy Bundakumar. I'm a psychiatric nurse practitioner, but more importantly, I am also on this self-development, self-exploration journey. I have struggled with depression and overthinking since I was a teenager. What is that from? I began my self-development journey at that young age. I even struggled with an eating disorder in my 20s and overcame that. And then in my adult life, I had a series of traumas. I lost a son in 2005 in a drowning accident. Then my son, Reggie, was diagnosed with a catastrophic neurological disease that ultimately took his life in 2016. Then in 2021, my daughter died in her sleep. And most recently, my husband passed away. So if anybody has a reason to be depressed or a reason to be worried and overthink, it's me. But where does that come from? Does it come from this life of difficulty that I've experienced, or how I can show up and respond to it? It's a difficult question. And if you were to go to a specialist, a mental health specialist, let's say you went to a psychiatrist and you said, I'm having these intrusive thoughts, I'm worrying all the time, it's making me depressed, they would recommend an antidepressant or maybe a mood stabilizer or something to biochemically try to correct what is going on. This is not a bad thing. I'm not saying don't take medicine. But what it is doing, it is treating the symptoms. That's all we can do in psychiatry. And I'm a psychiatric nurse practitioner, so I prescribe medication. And I often recommend medication. But what we are doing with medication is we are trying to treat the symptoms that have, come up. But what are those symptoms from? Some people will say that it is genetic disease state, and we definitely see this in families, genetically in families. So there could be definitely a predisposition to having some of these struggles, right? And if you need medication, take medication. But don't stop there. Keep watching so you can learn kind of some of the underlying causes and what you can do about that. Maybe you go to a counselor or a psychologist and they tell you, this is just your personality. You're an anxious type person. You are always going to be an overthinker. Just learn to cope with it. Let's learn some coping skills to cope with that. Coping skills, also good. You need coping skills. We all need coping skills. But what if we could learn coping skills and at the same time figure out what's underneath that's causing some of that? Maybe you go to another counselor or therapist and they tell you, oh, this is trauma. You have trauma. The trauma that happened to you is what is causing this overthinking. And I can tell you a story about this. When I was in counseling as a young adult, I was told that it's trauma. You have trauma. And I thought big T trauma, and that therapist didn't correct me when I thought big T trauma. And when we think big T trauma, we think sexual abuse, physical abuse. I had no recollection of any kind of abuse in my childhood. And I went to my mother and I said, I had to have some trauma. I had to, possibly be sexually assaulted. And we went through this rabbit trail of nothing. Of, oh, maybe this person in my life did something to me, or maybe this person, and then, the guilt that I gave my mom that somehow she had done something that she didn't know about that caused trauma in my life. Yes, it could be from trauma, but it is not always from big T trauma. And we're going to talk about what trauma, what life experiences can do to our programming, our subconscious programming, and how that manifests as, kind of overthinking, intrusive thoughts. Maybe you go to like a holistic doctor or an integrative medicine doctor, an acupuncturist, a chiropractor, and they tell you, oh, this is just a maladaptive alignment to your energy work or your chakras or your, maybe it's the vitamins, you're not taking in enough vitamins, here, take these supplements. And I can tell you, I am very well versed in this. And in our Grief Intensive, we teach energy work and we teach nutrition, and all of those things are also important. It could be all of these things, and you have to, and I know saying have to is not something you want to hear, but taking ownership, responsibility for your mental health journey, figuring out what is true for you, and making yourself healthier, both physically and mentally, because they are connected. And this is kind of my passion. I feel like in the self-development world and in the medical world, both are teaching like this is absolute truth. Disease state is absolute truth. You have depression, you have a personality disorder. Trauma has caused this in your brain. And in the self-development world, they're like, well, you just, are on your own journey. You can do this yourself. And both are true. And it takes some stopping and educating yourself on what causes these things. So what causes these? And we're talking specifically about intrusive thoughts and overthinking. So I want you to think about your conscious mind, right? This is, just think of like your highest level of thinking is your conscious mind. And that is overthinking. And I have learned that my overthinking can actually be good. It can be problem solving. I can learn to think through things, and I can get better because I think through them, right? But overthinking creates what we call rumination. It's usually negative thoughts. But our thinking brain is our conscious mind. Underneath that is a subconscious mind. And you probably know this, you've probably dabbled a little bit in it, but it doesn't make clear sense. I'm going to break it down elementary style, because that's how I learn, is breaking it down elementary style. So there's a part of you that is a conscious mind. You can think, you can problem solve, you can be creative, you can be innovative. That's what makes us humans. But there's this subconscious mind that's actually more hardwired. It is more of like a program, a software per se, that is going on in your body. And softwares can be updated and changed, but they run by themselves. In the Mentally Strong method, which is how I teach how to think, organize, and choose, I call this your core connections. Like, what is underneath all of that negative thinking? For me, some of the things that I've struggled with is that I'm not smart, I'm not good enough. These are my core connections. This is the subconscious, and it's kind of programmed in. And so you have to learn how you can be reprogrammed. Okay, so look at this little drawing that I did. Okay, this is your conscious mind here at the top. And if you are overthinking in a negative way, which overthinking by definition is negative. Doing something too much is not good. Overthinking feeds the subconscious, already programmed. It's programmed there, right? But you're feeding it. So if I'm thinking, I can't do this, I'm not good enough, why is everything so difficult? And I keep thinking like that. That's my overthinking, and it's feeding that subconscious negative programming that I have in my subconscious. When you're having intrusive thoughts, it's going the other direction. Your subconscious, these negative programming that you have, is just shooting up a thought. You're not good enough. You're stupid. Why are you doing that? In extreme cases, people have intrusive thoughts that tell them to do bad things, hurt themselves, hurt other people. In that case, you are always seeking psychiatric care, because everything has a limit of disease state. Even if it's coming from maladaptive programming, it's still, when you are thinking about hurting yourself or someone else, that is a disease state. But let's go back to what do we do about that? This subconscious mind is hard to figure out because it's subconscious. We don't know it's there. People that are proponents of ACT therapy do something called cognitive diffusion. And that is where you're trying to bring a space between these thoughts, the overthinking, the intrusive thoughts, and the emotions underneath them. I'd like to take that a step further of like, what are the emotions underneath them? There's lots of trauma work, EMDR, brain spotting, any kind of meditative trauma work that is trying to separate the emotion from the thought is going to be effective here. But when you're doing that, I want you to think that you are not only emotionally disconnecting, but you are learning, like you're learning to reprogram. And so when you emotionally disconnect, now is the time to reprogram. So people will talk about, oh, positive talk, positive talk. And, you know, this is why I have core connections and negative thoughts separate in the Mentally Strong method, because negative thoughts, you just need to replace them with positive thoughts, right? I think I'm stupid, say I'm smart, I'm smart, I'm smart, right? But if you're saying that and you don't actually believe it, it's because the programming underneath, which is the core connection, needs to be reprogrammed. And so if you can disconnect and then reprogram, that's going to be more effective. So let's talk about trauma work. Trauma work is often reserved for people who have experienced what we call big T trauma, physical abuse, sexual abuse. And I, for a long time, refused to acknowledge my trauma, right? I've lost 3 children. That is traumatic grief. And I talk a lot about that in some of my other videos. In traumatic grief, that is trauma, but I didn't realize that let's redefine trauma. Or maybe we reserve trauma for real trauma, but we say everybody has faulty programming that likely started in childhood. And so recently I went to a performance therapist, right? A PhD in performance psychology, and I went through his program. And in his program, he actually does trauma work, which I found very interesting because like I said, I often don't identify as having trauma in my childhood. But most of my faulty programming happened in childhood. And so we did have to diffuse some of that. And there was a very specific incident that came up as when I started to think that I am stupid. So, you know, trauma work can be effective in getting to this subconscious. But remember, after you do that trauma work, you need to reprogram. There's a technique called NLP, neuro-linguistic programming, that really works on this. It goes into the subconscious, helps reprogramming. I don't, adhere to a specific technique, mostly because each of these techniques you have to go through lots of education to be certified to do them, right? And I want to teach that finding what works for you and knowing what you're looking for, right? So if you are having overthinking and intrusive thoughts, you are looking for someone who can help you reprogram your subconscious thoughts, or you go on a journey to figure that out yourself through meditation, through education. Learn who you are, how you tick, what is underneath these symptoms that are coming to the surface. So I have a couple questions that came from viewers. And the first question is, I have been diagnosed with OCD. Does this apply to me? I think that it applies to everyone. OCD is a DSM diagnosis that is very clearly obsessive thoughts that must have a compulsion, like you must do something with those thoughts. And especially if those thoughts are dangerous, that you need psychiatric intervention, okay? Continue doing the treatment that you are doing for your OCD. But you can also go on this journey of where is this reprogramming? Now, does this mean if you can fix all your reprogramming, you'll never need medication? Maybe not. We live in a fallen world. We live in a world that there's so many factors to what we're going through, and there is nothing wrong with taking medication. But even the best medication regimen is only going to take care of about 50% of the symptoms. So working through and figuring it out for yourself is super important. Next question. I've been working with a therapist. I have intrusive thoughts and I'm getting better, but she's never talked to me about this conscious versus subconscious. Well, I'm a teacher at heart. I'm a psychiatric nurse practitioner, but I would much rather stand up here and teach you how to take care of yourself than sit one-to-one and help someone like a counselor typically does. But I can tell you, if you're getting better, then your therapist is working on reprogramming this kind of subconscious thought. So I just want your next session, I just want you to go in, tell her you watched this video about, conscious thought and subconscious thought and reprogramming, and you would like him or her to talk to you like a student, when you're going through some of these things, teaching you to be able to have insight and identify, what are conscious thoughts, where those might be coming from subconscious, okay? But if you're getting better, keep it up. Last question. What does this have to do with my grief? Many of my followers are stricken with grief. Maybe they've lost a child, a husband, a sibling, and that grief is significantly impacting their life. This has to do with grief because in traumatic grief, everything gets enmeshed. And I can tell you, if you are having trouble getting through your grief, then you are likely experiencing traumatic grief. Grief, they say, is a normal process that we will all experience grief, but when it comes out of order, when it comes by violence, when it comes with trauma, it also comes with chaos. And in that chaos, your grief is getting enmeshed with your trauma. Your grief is getting enmeshed with your negative thinking. So this subconscious programming that likely started in childhood and adolescence is impacting how you are working through this grief. So that is why it is important that even though grief feels like an external present moment experience, how you are experiencing it has a lot to do with your subconscious thought. If you are experiencing traumatic grief, please watch my video on traumatic grief and continue to learn how to be mentally strong.